Hello, everyone, and welcome back to the Coshocton Dentistry blog. This week, I am joined again by Dr. Dunlap, and we are going to be discussing bruxism. So first of all, Dr. Dunlap, just tell us what that is.
It's a very common thing. I'd say probably 80% of us do it at different times in our lives, but it's a parafunctional habit. And what that means is it's subconscious. You don't even know you're doing it. But it's very destructive. I've had some blogs on prior to this one about occlusal disease, and that's really what it is. Bruxism creates big wear issues with your teeth where you end up potentially just destroying them just from clenching and grinding.
Okay. So we're clenching and we're grinding, and this is what it can do to our teeth. What are we seeing here?
Yeah, as you see in the image, that person has worn all the way through the enamel, all the way through the next layer and dentin, and they're kind of into the third layer of your tooth, which is really kind of where your nerve and blood supply is. So that person's in trouble. I mean, a lot of times people will come in with, teeth that the pulp is pathologic just because they've worn through to everything. So yeah, it's a very destructive thing. And a lot of times what is crazy about it is you don't even know you're doing it. And, I've had people swear they don't do that. And then, like, for example, one person was a truck driver, came back in the next appointment and said, I do it in traffic. I notice when I'm in traffic and driving as a truck driver, he has that issue. So not an uncommon thing. We make a lot of occlusal guards to help patients with those. Occlusal guards are very simple things to treat that and just kind of basically allow you to wear out plastic instead of your teeth.
Now, the last image that we have here, it talks about TMD or TMJ. Yeah. We've talked about this before in the past, but talk to us a little bit more.
Patients that do clench and grind a lot, that's kind of another potential side effect is it can go so far as you get joint issues where it actually, can damage the joint. And you can imagine just the chronic overuse and inflammation of that joint, like any joint, can create breakdown, and that's what TMJ is a lot of times. It's muscle damage, muscle overuse that causes tooth destruction and can hurt your joint. So the occlusal guard is a simple product that we use a lot of. Again, they're really designed specific to your mouth, and we spend a lot of time milling them in to get you a good proper bite and allow you to hopefully decrease the amount of bruxism.
Okay, so for TMJ, obviously you are going to feel a pain. My last question is just, in that very first picture we saw where the person had really ground their teeth down to like the lowest level, was that not hurting them? Did they feel that in their teeth?
You would be surprised how many people come in with that look all day long. And they don't have any problems at all. Don't understand why you're even asking them about it. But, it's not normal wear. I mean, a lot of patients will say, well, I'm just getting older. Well, they are, but they're wearing their teeth in a like I say, an abnormal way, the parafunctional habit. It's something that you don't even know you're doing, but it's very destructive. And it's not chewing your food kind of wear. That's just a habit of clenching and grinding.
All right, Dr. Dunlap, well, thank you so much for telling us a little bit more about that and answering those questions. And, as we said, in that first picture, if you are noticing that you maybe have some wear on your teeth and you're not really sure why, but maybe it's not that extreme yet, as Dr. Dunlap said, you're gonna want to come in and get that taken care of. So you can schedule an appointment with Coshocton Dentistry by giving them a call. You can schedule that appointment with Dr. Dunlap or Dr. Lauper, and you're gonna wanna explore the rest of their website too, CoshoctonDentistry.com, where you can learn about their other services and check out more of our blogs. Thanks so much, Dr. Dunlap.
Thank you, Alicia.